care, currently serving as a residential counselor at Community Living, Guelph, Wellington. A master's degree holder in counseling psychology from Nigeria, and currently pursuing a master's in mental health psychology at Yorkville University in Canada. I will be stopping there for my introduction because we'll just dive into what we're going to be doing today, but we're talking about menopause and your health. I'm particularly very passionate talking about this topic. I'm very enthusiastic about it. I'm excited to be hosting and to come and learn as well. We are here to discuss a topic that is usually whispered, a topic that women don't come out to really speak about, a topic that people are not comfortable to talk about, a topic that everybody wants to just bear the pain, everybody wants to hold it together, but why suffering? But we are here because we want to jump past that suffering. We want to jump past that whispering. We want to start screaming menopause. We want to start shouting menopause. We want to talk about menopause with confidence. We want to talk about menopause with our shoulder up high. Menopause is not a disease. Menopause is a natural phase in every woman's life. Menopause is that phase that you and I, either we are facing it or we are about to face it, or we know someone that is going through it. It's a journey. And what are we here for? We want to tell us how to go through this journey with that confidence, to go through this journey with joy. Don't feel depressed, don't feel down because you are going through the phase. So this morning with me, I'm having two amazing ladies, Dr. Lucy Idiese and Dr. Omotayo Abiara. I want to specially say thank you to these beautiful women for accepting to come and join us. The first person I will be calling to speak to us on menopause and your health is Dr. Lucy. Dr. Lucy, an esteemed consultant, radiation and clinical oncologist at the University of Benin Teaching Hospital in Edo State, Nigeria, where she has also served with distinction as head of department. Her leadership extends beyond the hospital walls. She is the former secretary of the Medical Women's Association, Oyo State chapter, and has served as president of the Edo State chapter. Currently, she brings her dedication and voice to the Medical and Dental Consultant Association of Nigeria at UBTH, where she now serves as secretary, following her tenure as financial secretary. Dr. Lucy imparts riches for deeper than her titles. She's a devoted advocate for women and the girl child, a committed worker in the house of God, and a true pillar of strength in both her professional and spiritual communities. She is also a proud wife and mother whose life reflects a seamless blend of compassion, leadership, and faith. Please join me to welcome Dr. Lucy Idiese.
Thank you very much, Queensley. Good morning, good afternoon, good day to every one of us. Thanks for this privilege to speak this afternoon. We'll be talking menopause and your health. Menopause is a journey that will come in the lifetime of every woman. At some point in time, it will come. So this time, we're going to be talking about menopause and your health and how to transit seamlessly from your menstrual cycle and period to pausing it. That's why it's called menopause. Your menstruation is paused. But the pause, is it permanent? Is it temporary? We're going to find that out. Thank you. So this afternoon I'll be looking at this outline, a woman's life. Can we all see the screen, please? Can we see the screen? Oh, thank you. A woman's life. Definition of menopause. We'll look at a little bit of epidemiology, the causes, some facts about it, symptoms, how do you diagnose menopause, ways of dealing with it and treatment. Then we'll now conclude. I'll try to do this within the ambient of time that I've been given. Wow, a woman's life. One night, you go to bed with your luscious hair, thriving libido, regulated body temperature, and the next day, you find out your hair is thin. You've gained 30 kilograms. And things that used to be of slight convenience are now becoming a personal vendetta. The life has changed and is changing. Why some women seamlessly transit from regular periods to menopause, menstruation pause, menstruation stop. Others can have a more challenging time. What is menopause? Spontaneous, natural menopause, because we also have unnatural or artificial menopause, if you want to use that term. Natural menopause is the permanent cessation of menstrual period after 12 months of amenorrhea. That's not seeing your period in a woman without any pathological or physiological cause. Menopause is actually a retrospective diagnosis. It has happened before the diagnosis date. It's retrospective. And it suggests a near complete follicular depletion and impracticable spontaneous conception. That means to get pregnant normally, naturally, becomes impractically impossible. The median age globally is about 51.4 years. Menopause, also known as the climacteric, is the time that ends the menstrual cycles of a woman. The period usually starts to become less frequent over a few months or years before it stops altogether. It actually comes gradually. There's some changes before it actually stops completely. That diagnosis is made 12 months after your cessation. That's after the menstruation stops. And it can happen in the age of 40s, 50s. But 51.5, 50 point, that's about the median age, even in the United States and worldwide. It's a biological nature and natural biological process. It will come. You cannot bind and lose it. You cannot say, no, it's not my portion. It will definitely come. And when it comes with challenges, but how to seamlessly transit is what we are looking at this morning or afternoon. Yeah, there's what we call menopause and there's perimenopause. Menopause is defined as the state of an absence menstrual period for 12 months. The menstrual transition starts and the menstrual cycle length and ends with the final menstrual period. Whereas the premenopausal, when talking about premenopause, it's a term that is used to mean the time around menopause. It's often used to describe the menopause transitional period. It doesn't just come once, gradually. Maybe a woman sees her period now, she's seen her period normally, it stops. In another 2-3 months, it comes again. You know, at least your body is preparing you for it to stop completely. This is epidemiology. If you look at this, we find that in different geographical variations, the age of menopause. In Africa, it's about 48.4 years. In Asia, it's about 48.8. Whereas in Australia, it's about 51.3. Europe, 50.5. Latin America, we have that. Even in the United States, about 51.3. So when we look at this, we say, okay, it's a period where they get prepared. What are the causes of menopause? Yes, menopause is natural. It's natural, but sometimes it's artificially induced. Some things can actually cause it. Some kind of procedures and interventions that people have can cause premature menopause. So it can come naturally, natural decline of the reproductive hormones as one approaches your late from 30, 40 years, the ovaries now begin to start making less estrogen and progesterone. That's estrogen and progesterone are the hormones that regulate menstruation. Then fertility declines at that time. In your mid-40s, your menstrual periods may become longer or shorter, it may become heavier or lighter, more or less frequent, until eventually, on the average, by that age of 51, the ovaries stop producing eggs and you have no more periods. So it's a natural decrease in the production of estrogen and progesterone, the reproductive hormones that regulate menstrual cycle. That's natural. We could also have some other causes. Number 2, we have complete hysterectomy. That's a procedure where both the uterus and the ovaries are removed. It can cause menopause. And this can be done due to some other health conditions. Some people, when they have excessive bleeding, dysfunctional uterine bleeding, some people have fibroids that are just there and causing a lot of issues, excessive bleeding. Any cause could be pathologically too. Then they remove the uterus. When that is done, menstruation ceases because the uterus and the ovaries have been removed. Then it can also be caused by chemotherapy or radiation therapy in cancer patients. When patients take chemotherapy, it can cause cessation of menses. Radiation therapy, same, can also cause that. So that can also cause menopause. Then we also have premature menopause when there's primary ovarian insufficiency, in which the ovaries fail to produce normal levels of reproductive hormones. What are some facts about menopause? Research has actually shown that 20% of women report distressing symptoms at menopause. Distressing is so terrible, they cannot even cope. They will have to start using therapy or medications or some other ways because it's actually really terrible. Whereas 50% have no problems at all. So some women actually transit without any problem. Generally, the greater proportion, 65%, have a variation of symptoms, which we're going to be mentioning. Women who have nurtured supportive network, they suffer less than women who are emotionally isolated. So even psychology, like my friend here who's a psychologist, can also tell that psychology can also affect how you transit menopause. What are the symptoms? Here we have symptoms varying from person to person. Irregular menstrual cycle, that's how it starts. The periods are no longer regular. Maybe the person gets period every month, every week, and maybe every particular period, particular number of weeks. For now, it can be 2 months, it stops, comes again, at least becomes irregular. Weight gain, yeah, mid-age crisis. That's what we call it. Begin to gain some weight. We have some vasomotor symptoms. Hot flushes, that's one that is so common. So common. And it can last for maybe about 10 minutes. The woman is just sitting there. The next thing, she begins to sweat. And it's what's happening? But some people have ascribed to witchcraft. Maybe somebody in the village is causing this kind of problem for you. It's natural. That's why we're talking about it. That's why we're getting away. So that we will know that when this thing comes, it's not anybody causing it. It's not what you have eaten or what you have drank. It is just a natural phenomenon. Night sweats. It sweats so excessively. Then we also have sexual symptoms. Oh, that is when there's decreased libido. That sexual drive is no longer there, unlike before. Arousal disorder, everything starts coming down. We have sleep symptoms, inability to get a good night's sleep. Then mood disturbances, mood swings, anxiety, depression, sometimes irritability. Sometimes women just get so irritable. Then genitourinary symptoms are there, musculoskeletal osteoporosis, bone pain, vaginal dryness. Those are some of also the symptoms, irritation, itching, and all that. These are all the symptoms, just put it from head to toe, hot flushes, headaches, down to, people having, you have things like losing of teeth, cardiovascular symptoms, you have backaches, all these comes with aging. You have myriads and myriads of symptoms, vaginal dryness, itching, sensation, and all that. This is a pathophysiology of how it comes in the different organs and how it ends. When you come on CNS, vasomotor, you are going down to things like hot flushes. When you talk about urogenital system, you're talking about pelvic organ, you have issues there, talking about all the different places, bone, we have osteoporosis, bone pain, and all that. So this is just like an algorithm of all the symptoms that can be gotten. Now, how is menopause diagnosed? Hormone variations are common. It is difficult to diagnose menopause based on the hormone levels. The absence of menstrual period after 1 year confirms menopause. In rare situations, specialists may prescribe blood tests, hormone tests, try to check the follicular stimulating hormone, estrogen levels, and all that. Most times they are reduced in menopause. How do you deal with menopause? Drug therapy, exercise, other efforts like vaginal lubrication, vaginal moisturizers can help women with dryness and lubrication, and can help with lubrication difficulties that may present during intercourse. Low dose prescription vaginal estrogen products such as estrogen creams are generally a safe way to use estrogen. But when it comes to estrogen, we have to be also careful, which we also mentioned. Vaginal cleaning and dryness problems can also be sorted out that way. Now, in terms of managing hot flushes, which I say is one of the main symptoms, lifestyle measures, such as drinking of cold liquids, staying in a cool room, because people are always sweating. So we just try to help ourselves. You can have a hand fan wherever you are going out. You know, they try to stay in a very airy place, remove excess clothing, try to wear light things, avoid hot flash triggers such as hot drinks, spicy food. Then those ones may partially supplement or even obviate the symptoms. Some women go as far as medications. Then individual counseling and support group can help. Imagine you hearing now that Mrs. A has the same symptoms. You say, oh, so I'm not the only one. You are psychologically prepared. You know something about this psychology preparation is when somebody tells you you are going to have this problem, your mind is already set to receive the problem. So when the problem comes, it's less. The problems now, at least when you navigate it, so you say, oh, I was expecting it to come, and it's seamless. Osteoporosis can be minimized by smoking cessation, adequate vitamin D intake, and also have weight-bearing exercises. Drugs, there's actually no specific medical treatment. There's no specific medical treatment to be used. Oh, this is a drug I'm to prevent menopause. You cannot prevent it. It must come. Treatments are actually aimed at reducing the signs and symptoms. Some medications like low-dose antidepressants could be prescribed to control the mood swings and hot flushes. Anticonvulsants also help to reduce extreme hot flushes. Therapy, we look at hormone therapy. Administration of estrogen and progesterone have proved to be effective for relieving menopausal hot flushes. Self-care, healthy diet, exercise may release symptoms. They include use of calcium, protein-rich diets in your food. Practice yoga, which this helps in regulating your body rhythm. Hormone replacement therapy is the use of estrogen in women without a uterus and progesterone plus progestin in women who have a uterus. Hormone replacement therapy may be reasonable for the treatment of menopausal symptoms such as hot flushes. It is the most effective treatment option, especially when delivered using skin patch and all that. Its use, however, appears to increase the risk of stroke and blood clots, so one has to be careful there. So when used for premenopausal symptoms, some recommend that it's used for the shortest possible time and the lowest possible dose. It also appears to be effective for preventing bone loss and osteoporotic fracture. Nutrition, very important. A healthy diet can help to ease the symptoms. Foods to include calcium-rich foods such as milk, fish, broccoli, legumes, high intake of omega-3 fatty acids, whole-3 eggs, leafy green vegetables, nuts, enriched grain products, fiber, whole grain fiber, whole grain bread, cereals, pasta, rice, fresh fruit, vegetables. Eat quality fruits and vegetables, not only for menopause, for all health conditions. Fruits and vegetables. Plenty of water, at least 3 liters per day. I can see my friend taking some, I guess I think some fluid or water there right now. That is the way it goes. Yeah. Foods to avoid. High fat foods found in fatty meats, whole milk, ice cream, and cheese. Yes, when you're aging, you have to cut down a lot. People will tell you, no, you have to. It's all the process. Limit sugar and salt intake. Avoid spicy foods, caffeine, and alcohol. In conclusion, this afternoon or morning, menopause obviously comes with aging. It is a time of great changes physiologically, emotionally, psychologically, and even spiritually. Menopause is not the end, but rather it's a time of new beginning, a time of a fresh start in life, a time in life when one can approach life from one's own unique perspective rather than having to approach life from other perspectives. It is a time to heal old wounds, old losses. They have gone too far. You let go situation. By the time you are attending menopause, you're like, I'm already aging, so all those excesses need to be cut down. Circumstances, everything. No, you no longer put people in mind. You let to forgive, let to love everyone. And most especially, is a time to have a close relationship with your maker. It's very important. It's essential as we age and we grow older. This is the life of a
I think our internet got frozen. I hope we are enjoying the time so far. So the good thing is that she's at the end of her presentation before the internet interrupted. So I will just give us a little bit of what she's trying to say before I introduce our next guest. Just stay back and enjoy yourself. All right. Now she
accidentally muted herself. Yeah.
Oh, okay. Our internet is back.
No, I'm not sure, but she's muted. But you okay, Dr. Lucy?
Yeah, I'm back. I'm back. The internet went off. Sorry about that.
So
please go ahead.
You just round up. You were about to
I'm done. Thank you so much. I think my second to my last slide was talking about supporting women's health and fertility as you grow from age to age. Can you still hear me?
Yeah, sure.
Yes, until aging to become a grandma and possibly a great grandma, and that ends the journey. Thank you so much.
Thank you so much, Dr. Lucy. That was very, very interesting and deep. We are still going deeper as we move forward. We are going deeper and deeper. And as we move forward, you find out that menopause is you can't even finish it in one session. I have, when I was going through my menopause coach training before I was certified, I was blown away with what I discovered, what I was thought. Like I said, all this talk about menopause, all this whispering about menopause is something that we have really believed the myths, even over the facts that is about menopause. There are so many facts about menopause that it's something that you take with grace. You accept it with grace, and once you know, I keep telling people this, whatever you know reduces the stress involved. When you know about something and you are aware that if this thing comes, these are ways you can, reduce all the anxiety that comes with menopause. Like she just said, all those mood swings, how you can sit in a hairy place, or how you can hold your hand fan, how you can, hydrate yourself like Dr. Motayo is doing. Those are the things. By the time you are aware of those things, you will find out that the stress is reduced, the tension is reduced, the anxiety is reduced. And again, coming back to the psychological aspect of it, on the mental health aspect of it, you discover that most of the time when you will know how to address issues. When your spouse is talking to you, you are not always antagonistic. You are not, because within you already know that something is happening, something is controlling your emotions. Because you are aware of it, you are able to control yourself. Sometimes when you want to do this, like, no, you can't tell me that. And you remember that, oh, come on, don't let people think you are losing your mind. because you are not actually losing your mind. There are certain things that is going on in your body that people around you may not understand. Even your spouse, your children will be wondering, what's wrong with mommy? What's wrong with my wife? She wasn't like this. If she was like that, I wouldn't have. Not every man understands menopause. I wish men would come together and they will be thought about menopause so they'll know how to, live with it with their wife and support their spouses. So now I'm going to introduce my next guest. I'm always so excited when I'm talking about menopause. I don't know why. It's like something is sweeting me. Right. Now we're going to be meeting our next guest, and she's no other person than Dr. Omotayo Abiara. I love that name, by the way. A distinguished family physician with the Saskatchewan Health Authority at Northeast Medical Clinic and an assistant professor in the Department of Family Medicine at the University of Saskatchewan. Fondly known as Dr. T.Y. Oh, and okay, I'm right then. Among her colleagues and friends, she brings a wealth of global experience and academic excellence to her work. Born and raised in Lagos, Nigeria, Dr. Tayo Abiara completed a medical degree at the prestigious College of Medicine, University of Ibadan. She holds a fellowship in women's health from the West African College of Surgeons and earned a master's in clinical embryology from the University of Leeds in the UK. Before moving to Canada, she served as head of clinic at the Bridge Clinic in Lagos, Nigeria, where she led with compassion and innovation. Upon immigrating in 2016, Dr. Abiara embraced Canada's diverse healthcare landscape, starting as a personal support worker with autistic youth. Well done. This experience deepened her respect for inclusive care and Canadian values. By 2020, she joined Saskatchewan's medical community, having earned her license of the Medical Council of Canada and later receiving certification from the College of Family Physicians of Canada in 2022. Dr. Abiara is not only a devoted advocate for women's health, but also a passionate mentor for international medical graduates and students, inspiring the next generation of healthcare professionals. With her journey of resilience, excellence, and service, she is also a proud wife and mother of 4, balancing her vibrant career with a deeply rooted commitment to family. Join me in welcoming my beautiful sister, Dr. Tayo Abiara.
Thank you very much. Thank you very much. That was a bit of a glaze. I'm like, is that me? Thank you so much. Good morning, everybody. And let me say thank you to Quinsley, who is our chief host and organizer of this forum. Thank you for all you're doing. Thank you for being committed to women's health. And thank you for making time to study to make the life of other women better. Thank you so much. And I also want to say thank you to Dr. Lucy, who has actually done a lot of the academic work. I hope you were all listening. So my slides are more summarized because I think I'll be doing more of the question and answer. So I want to tell the audience to please type in their questions. I'm sure you have a lot of questions already. Please type it into the chat. You can find the chat on the right of your computer, but if you are on the phone, you'll see it at the bottom of the Zoom page. Type in your questions. But otherwise, we will still have time at the end of my presentation to take verbal questions, from everybody. And the 3 of us will share out the questions so we can answer in a broad way. So I'll be sharing my slide. Okay, can you see my slide with a blue background? Queensley?
Yes, we can see it.
Okay, all right. So we're here talking about menopause and you and your health. So I'm gonna briefly talk around these following topics. I'll just summarize what Dr. Lucy said about menopause and you. Why does menopause happen? And why does it happen to you, right? Why does it happen to us? Okay, summary of the symptoms and signs. And then when these are happening and debilitating, where do I seek help? What do I do? What are the things I can do? And then we'll take the questions. I'll encourage everybody to stay on because the question and answer session is usually where, you know, the real women talk about their experience, and then you can see how that relates to your own life, and then you get some answers. All right, so like Dr. Lucy said, menopause is diagnosed retrospectively, meaning you diagnose it a year after it happens. When a woman has missed a period for 12 months, if she has a regular cycle, or 12 regular cycles, you know, so we diagnose it, oh, I attained menopause last year, June. Then we know you're menopausal. But there's a period before that final last period where the periods either become irregular or they become scanty or they become too heavy, you know, you just know something is different. And that period, usually 5 to 10 years before that last menstruation, is called the perimenopause. And it extends usually till 5 years after the menopause stops, 5 to 10 years. And menopause, meaning pause means stop, right? Or pause. Wait a moment, means the period are pausing, the periods are stopping. And it is the end of a reproductive lifespan of a woman. It doesn't mean the woman needs to die. It just means she's done with childbearing and ready to move on to greater things. Greater things like, you know, enjoying her life for herself because she's spent half of her life taking care of children. Now she can focus on herself, grandchildren, her spouse, her career. You know, you can become that vibrant 50 to, you know, 90-year-old woman. And you know, when a woman is pregnant, she misses her period. So we must have confirmed that there is no pregnancy before we diagnose menopause. And the reason why it happens is each woman or each girl is born with a fixed number of eggs from birth. So as we get older through puberty, a lot of eggs are lost each month with each menstrual cycle. So eventually the two ovaries we have exhaust their stock of eggs. But it is the cells around the eggs in the ovary, the follicular cells, that release estrogen and progesterone. So once the eggs are done and all those things are done, the estrogen and progesterone start declining. And all the effects of estrogen and progesterone start going down. And that's why women start noticing fatigue, dry skin, you know, low libido, and so many other, you know, dry vagina, difficulty. I'm going to come to that. So I'm just explaining that the issue is the ovarian reserve declines, and so subsequently the hormones start going down, and then all these other symptoms begin. And it happens at different ages for different women. If you remember, all women start menstruation at different ages. Some start at 8, some start at 10, some start at 14. The same way, the period stops at different ages, but the average age in North America and Canada is 51, but it could be anywhere between 45 and 55. And then sincerely, the reason why we're all here is because menopausal symptoms cause significant distress to a lot of women. It affects lifestyle. It affects relationships. It affects, your mood, so it is a cause of significant morbidity to a lot of women. And I hope that after this presentation today, we can help us identify ways to make our lifestyle much better. So like I said in the last slide, that why you? Yes, you, because you're a woman and you have two ovaries, and ovaries do their work and eventually finish their work. So once they exhaust their stock, the hormones begin to wane and then the symptoms start. It's important to say that when the periods stop before the age of 45, it is called premature menopause. If naturally your period just ends before age of 45, it's called premature menopause. And if that happens to you, of course, you should present to the doctor to make sure that nothing else is underlying. But people can also get to menopause due to medical treatments, like Dr. Lucy identified. If there has been other problems like endometriosis or some other issues with the ovaries, and the patient had hysterectomy and removal of both ovaries. Usually when they're doing hysterectomy for a young person, they leave the ovaries behind. So not everyone who has had a hysterectomy had their ovaries removed. But if for any reason the ovaries had to be removed, then it's likely that that person will have a surgical menopause. People who have had chemo or radiation therapy for cancers or other treatments can also experience a surgical menopause, because the irradiation also affects the ovaries if it is a pelvic radiation. But naturally, it's due to just decline. It's a physiological thing, it's not a disease, like Dr. Lucy said. It is a state, just like, oh, I've started my period, the way it was. So now we should be excited that, oh, the periods are gone. No more tampons, no more sanitary towels, no more wet days. All right. But of course, with it comes the other symptoms, which we have to gracefully handle. Yeah, so because the estrogen and progesterone hormones that we have during our reproductive years affect every part of our body, from the skin to from the scalp, the hair, down to our toes, including our skin. So when menopause starts, we see the effect in all these parts, but different women experience it to different degrees. And even in a particular woman, you may experience it in different systems at different times. Okay. So this week I had one of my close friends at work come to me, oh, my hair is thinning out. Oh, my mood. I'm like, yes, it's menopause, but we're going to investigate to find out if there's any other thing causing this. So we did some blood work to make sure no other deficiencies causing the thinning hair and all. And if nothing else, it is. And the patient is above 50. There we are. It's menopause. So this is just a picture I found on the web, which I thought could be graphic for us to, enough for us to identify with. Sometimes you just find out that the brain fog, you just think about, is this dementia? You have to double check that, oh, is this dementia? No, it's just that, unable to think straight, like you just feel so clouded. Remembering things is part of the menopausal syndrome. Brain fog, thinning hair, at the edges. Me too, I'm having it, but I'm rocking it. Thank God for wigs. Thank God for styles. Okay. Hot flashes. Now, hot flashes and night sweats is let's say 90% of women who present to the doctor for menopause come because of that hot flushes. It's the most distressing symptom of menopause that makes people go to the doctor. Other things that people may or may not present for are bone loss, weakness of the bones, dry skin and nails, weight gain. You are doing all the exercise, you are on all the diets, but that abdomen is just not respecting your effort. It's due to the hormones. Then sexual dysfunction. A lot of women are experiencing this, but not a lot of them are presenting for help. Okay, you just find out that you're just not in the mood. It's not just tired, you're just not in the mood. And when you even ginger yourself and say, okay, let me get down to it, you find out that it's painful, you are not as wet as you used to be, all those things are due to the declining estrogen. Then some people experience symptoms in their eyes, dry eyes, mood swings. Yes, you are more cranky than usual. Dr. Lucy and Quinsley also said it, you just find out that your fuse is short, which may also be related to the sleep issues, the sleep issues, the hot flushes, you don't feel good with yourself. So you may probably be reacting to all that. So 3 out of 4 women would have menopausal symptoms. But it's important to let you know that some women go through menopause seamlessly with minimal symptoms. Not that the changes are not happening, but it just doesn't bother them, or they may be more prepared. So this is one of the reasons why we're talking about this. Like, if you know what is going on, then you will, find lifestyle measures to address it. Or if you need medication, you would know that, oh, it's better I get medications. So irregular periods, sometimes they become heavier than usual. Sometimes they go for 3 months and then come back, go for 6 months, and then you see it. But we diagnose menopause when you've missed it for 12 cycles. You find out that intercourse is more painful due to dryness, you are less wet. But when you are experiencing this, it's still important to see your doctor to make sure it's not an infection, because that could also cause painful intercourse. The libido part, you take out the normal stress of work, other emotional problems, libido generally declines. You are just not thinking about it. But there are a few women whose libido increase, very rare though, at menopause. But we still have help for this. There are medications, there are lubricants, which I'll come to later. Urinary symptoms may include either increased frequency of urination, or you find out that sometimes it's painful when you pee and you've been checked for infection. It's not an infection. It's due to dryness in the urethra. So that could happen. Then there's also the problem of prolapse, which happens because the pelvic floor is also tired and everything starts to drop. Mood swings, anxiety, sleep disturbances. This may be difficulty falling asleep, or the hot flushes or night sweats stopping you from sleeping. Headaches unexplained. Temperature dysregulation is part of the hot flush part. They're called vasomotor symptoms of menopause. Vasomotor means related to blood vessels and related to, active sweating. It's just that hot flash is like a sudden wave of heat. Usually starts from the chest to your head and then lasts like 2 or 3 minutes, and you are drenched in sweat. You need a fan, and then suddenly it's gone again. Some women experience some palpitations before it starts. Some people, it stops them in their tracks. Like if I'm talking now, maybe doing something, I've had a woman who is a lecturer and says when the hot flushes come, she just stops. She can't talk anymore. She just has to attend to that heat. So it could be that bad. Breast tenderness or tingling, and memory problems. I'm going to try to be fast so I can answer all your questions. So when we're experiencing all these things, of course, you talk to your family doctor. If you're in Canada or North America or the UK, in Nigeria, there's easy access to specialists, so if you have a gynecologist you've seen before or for any other reason, yes, you can talk to them as well. And then, very importantly, which is a step a lot of us miss, it's important to talk to your spouse, because men don't understand why you don't feel like. They don't understand why is it painful, So, and a lot of them don't really know the effect of menopause. They know your period has stopped, but they don't understand all the other symptoms that come with the package. So maybe the next forum we have, Quinsley, let's throw it open to both men and women, because it's important that the men are also aware so they can be more understanding, so that the effect of menopause on relationships can be reduced. If you have it, imagine having dry vagina and you are using lubricants. It's nice that your spouse understands why. It could even help you apply it, so many innovative ways of, making the bedroom more spicy. If you are being cranky, he just leaves you alone because he knows you need a moment. So yes, we need to communicate with our significant other so that they understand what is going on. All right. And then always, always, always don't neglect your girlfriends. See this community of women now. Very soon, when we get to the question and answer session, you are going to see that you are not alone. So if you have a trusted friend who is about your age, it's important, or let me not say important, it's helpful to talk about these things. All right. And it's not a topic of gossip because everybody is going to go through it. It's not a disease. So what can we do? All right, we've talked about lifestyle choices. Dr. Lucy highlighted some medications, exercise, diet. All those things are helpful to help us go through menopause. However, if the burden of the symptoms like hot flushes, night sweats, if the burden is heavy and your life is not your own, you're kind of not in control of that, it is important to seek medical help. So declined estrogen levels, which is related to menopause, is also related to our cardiovascular health. Okay, women are they are more prone to, after menopause, more prone to maybe heart attacks. Women who have a lot of vasomotor symptoms are more prone to heart attacks and things like that. So it's good that we present for help. If a woman is experiencing like 20 to 30 hot flushes in a day, you should seek medical help. Now, the most effective treatment for hot flushes is actually hormone replacement therapy. That has been documented, right? But not everybody qualifies for hormone replacement therapy. There are some contraindications to hormone replacement. Hormone replacement therapy means medications that replace our estrogen and progesterone and their hormones, but they are not without their own risks. So there's a category of women who cannot take that. So for those who cannot take that, there are non-hormonal measures that can be used medically. And if you are one that, oh, I want to do natural before I even try any medications, there are lifestyle suggestions you can use. But first of all, I want us all on this forum to own it. Like, just like your period came, your period is going to go. It is just a stage of life. So once you accept it, then you are willing to move forward. Then what can you do? It's an age thing. Let's start aging gracefully. Let's start rocking it. Let's start making it, something we're not ashamed of. And then talk to your doctor. And then it's time to work on your diet. Not just feeling it like a chore, like something I have to do. You have to get excited with choosing food items, forming up your diet. Oh, this is what I'm going to do. Start getting excited about planning your meals so that it is a sustainable lifestyle change. It's time to leave that car and take a walk. It's time to go on your evening walks. Time to exercise. Engage yoga because the processes have been found to help women cope better with menopause. It's always helpful to find a friend. All right. And then stress management and managing your emotions. When that wave of irritability comes, you have to remember that you are not alone in the world. And it is not the fault of that person next to you that you are feeling the way you are. It's your hormones, it's your body. You can just tell them, oh, I need a moment. All right. Don't take it out on them. And then we need to dress appropriately, especially when going to bed at night. You may go to bed just wearing a one-layer pajamas, and then you wake up in the night shivering. So you need to have a blanket close by. If you go to bed with a heavy night wear and you wake up sweating, of course, in my own night sweat, I always have to take off that nightwear and change to something else, change the bed sheet. It's that bad, So we have to find ways of handling those. So I mentioned earlier that there are some people who cannot take hormone replacement therapy. So people who are pregnant, they cannot take hormone replacement therapy. People who are breastfeeding, well, I don't expect you to be breastfeeding at 21, but we have people who had a delayed conception, maybe needed artificial assisted reproductive techniques, you are breastfeeding, and because of all those hormones giving you at that time, you can have a baby. But if you are now, after that, if you are now experiencing symptoms of menopause and you're breastfeeding, you can't take hormone replacement therapy. People who have liver problems, liver enzymes are raised or other liver problems, you can't take hormone replacement therapy because it is the liver that metabolizes those hormones. Then other signs of liver disease like jaundice, gallbladder problems, liver tumors. Then people who have breast cancer, ovarian cancer, or uterine cancer, because these cancers are hormone related. Family history of breast cancer is a contraindication, all right? And any suspicion that this patient could be at risk of breast cancer is also a contraindication. Now, relative contraindications that mean that one in which is individualized could be people who are heavy smokers, who are smoking more than 15 cigarettes a day and, actively smoking. You want to discuss with the patient on the risk and the benefit. Also, people who have had deep vein thrombosis, that's blood clots in the leg or in the chest, anywhere, if you've had blood clots before, it's better not to take hormone replacement therapy. So, but the hormone replacement therapy, like I said, is the most efficient treatment for vasomotor symptoms, for hot flushes and night sweats. And they come in form of pills, they come like patches, gels, vaginal rings. So there are different ways, but each patient has to be individualized. All right. But very importantly, we need to make sure that there is no contraindication. So apart from hormone replacement therapy that is so helpful, non-hormone therapy include some antidepressants in particular doses, things that we use for anxiety. They also help with vasomotor symptoms. Gabapentin, they are all available all over the world, but they are prescription medication. You can't just go to the chemist or pharmacy and say, give me that. No, you have to see your doctor and the doctor has to prescribe it. For people who have mild symptoms, who just want to know natural supplements, scientific evidence has not proven that they are helpful, okay? But a lot of people find them helpful. Evening primrose oil, black cohosh, and plant estrogens, containing many vegetables. They are all open. A doctor is not going to prescribe that, but we have natural paths. People who are into natural medicine who can prescribe that. And then cognitive behavioral therapy has been found not to stop signs of menopause, but to help women cope better. Evidence has shown that cognitive behavioral therapy helps. And Dr. Quinsley will be here. I hope you tell us more about that. So final tips before we take questions. If you look to the right of my slide, you see many colorful things out there. We should be familiar with them. Can you see what they are? Yeah, everybody should have, if you're above 50, you should have one of these in your bedroom, on your bedside table. They are vaginal lubricants, which help to reduce friction during intercourse. There's the usual KY gel, Replens, so many of them are available. Any pharmacy carries them. So, final reminder, menopause is inevitable. Just as you got your period will go. It is manageable. Your life does not end with menopause. We can rock it. That's our take-home message. We're going to start rocking it, not grumbling about it. Most common problems that make people very depressed or bothered by menopause are vasomotor symptoms, which are hot flashes, heat flashes, night sweats, and genital symptoms like difficult penetration, difficult painful intercourse, vaginal dryness, urinary symptoms. And that usually leads to relationship problems. And then I also want to highlight that I said that hormone replacement therapy is the best treatment for vasomotor symptoms, but is only for particular women with no contraindications. We already discussed those contraindications, but it is advised that these women must be within 10 years of stopping menopause. So I can't pick a 90-year-old woman who attained menopause 30 years ago and say I want to give her estrogen. And then these women, ideally, when you are starting hormone replacement therapy, they should be less than 60 years old. A lot of women who attain surgical menopause, maybe they had their ovaries removed at 40 or 45, they are usually started on hormone replacement therapy immediately because it's a sudden push into menopause and they experience a lot of vasomotor symptoms. And hormone replacement therapy has been life-saving for a lot of them. Non-hormonal therapy is also available, like I said. Please enjoy your views of vaginal, have them by your bedside, use them, talk to your spouse about them. And we also have other medications that help us with menopausal symptoms that are useful and helpful. So at this point, I'd like to say thank you to everybody for listening. And we are open to questions typed in, and I'll hand over back to Queensley. Thank you so much.
Wow, wow, wow. Thank you so much, Dr. Tayo. This is very, very insightful. And I hope we have all learned, or we are taking notes. We are listening, we are not distracted. And our questions have been written down. If you want to speak or you want to put it down in the chat, you are very free to do so. And I just want to encourage us that whatever question you are asked, this is a safe place. I want to re-emphasize on that. There is nobody that is going to, whatever question, you are free to ask any question that bothers you, any question that you want to ask. And we are here to help ourselves, because as we are speaking, I'm learning, I'm jotting down. I'm not the whole idea. The thing is, if you look at the chat, the Facebook link is there. Go there, make sure you follow us. We'll keep posting things there that will educate us, that will help us. It's not ending in this meeting. We are moving forward. I'm still going to meet with my beautiful sisters, way possible for us to expand and go further than this. We are not going to end it it's not going to end in Ontario, in Nigeria, in Saskatchewan. Whoever is ready to come on board, we are ready. And those around me here, I have a lot of people around. We can meet one-on-one, we can talk. Those things we can do. We can encourage ourselves. If you are not very good at going out to exercise, where can we meet? How do we meet? If twice a week, it's fine. If you can't do it, if it's once a week, that's fine. I know we are all very busy. All of us are working, we are paying bills, but please, let's take care of our health. It's very important. Thank you. Dr. Lucy, Dr. Tayo, is there anything you want to add from what she just said or from what I said?
Oh, thank you so very much for making that forum open and to everyone. Thank you for sharing. I also want to say thank you to everybody that joined and people who asked the questions. Maybe if anyone has any other lifestyle contribution, anybody from the audience that wants to share what has worked for them for menopause, just before we go. We just have a few minutes left. So if anyone has anything that has worked for you for your menopausal symptoms that you want to share, or how you manage a difficult menopausal thing, please, maybe in the next 2 minutes, please share with us. Thank you.
Maybe, hello, can I speak? Yeah, in my own case, lifestyle modification. lifestyle modification. Alternatives, I didn't have to go to use any form of tablets or hormones or whatever. No. I just noticed, oh, this is coming, especially when that hot flush comes like this. What I do, I started getting fans everywhere. And fan everywhere, in my bag, even in the car, everywhere I go. So anywhere I also go, if I go for a function or a program, I try to sit where there's either AC or fan close by or window. So just lifestyle modification. Then of course, eating, my diet changed completely. Try to take natural things as much as possible and do away with all the artificials and just try to be happy. Good exercise. I do a lot of exercise. I do gym. I have a treadmill. I have cycling. I have all of them around. So I do all that. Just put all the non-therapeutic issues on ground. And in no time, it became a story. It became history. I didn't feel any of that again, and I'm very good. So lifestyle modification, I think it worked for me, and I know it will work for as many people as will also adopt that. Thank you.
I just want to remind us that menopause can actually reduce your low self-esteem, give you low self-esteem and confidence. That's why when I was posting and doing videos, I kept talking about building your self-confidence, building your confidence back. You may not realize that because of what you are going through, that's why you just feel like you are not loved. At some point, I became very emotional. Every little thing, I tear up. But because I know that it's a phase, I wasn't bothered. I wasn't worried. I just allow it to flow sometimes. Sometimes I can control it. Sometimes I can't even control it. So every little thing, I just tear up. Quickly, there's a question. Drinking. So drinking boiled fresh natural ginger with a drop of honey helps to calm most of the symptoms. Grate and boil the ginger. Sieve and add a drop of honey. Trust me, it's magic. God bless you. Thank you so much, Chinwe. Yes, the reason why I didn't bring about food, because again, I didn't mention that I am a natural health and wellness coach as well. I'm a bit of everything because I love to study, I love to read, I love to know so many things. Like I want to know little about this and that. I didn't want to bring all this food here because I didn't want to mobile things up so we don't get confused. That's why I said, let's move on from here. Let's not stop here, because when you go to the Facebook link and you follow, from today, you start seeing posts on either on healthy living, on how to boost your energy level, your everything. And even for your confidence, you see posts about that. Then the medical aspect, Dr. Lucy and Dr. Tayo, we post, we bring some article that you can read, you can see, and you can follow. Then that way we are able to balance, because the balancing is what we are doing. We are balancing before the hormones. Before the hormones take hold of us, before our body start fighting us, we are going to fix it even before it starts, or even while you are already struggling. Some of us are struggling already. So even while you are strong, you can get yourself back. You can reclaim your health back, reclaim your vitality back, reclaim your confidence back, reclaim your energy back. So please, let's not end it here. That's my focus. And we have your emails. We'll still send to your email, but make sure you go to, sometimes we can go live. Dr. Tayo can just come live and talk to us. Sometimes Dr. Lucy can come live and talk to us, give us some hints, and your concerns can be, addressed in that live broadcast. So if we don't have any other questions or anything that we want to add to this discussion, I would love to thank. Oh, okay. Thank you so much to the host and all the speakers for this insightful topic. I got value for this time. Thank you. Thank you for your acknowledging that. All right. So thank you so much for coming, for your time. I know we are very busy. A lot of people registered, but they are not here. Maybe they are somewhere, they are in function. Some people had to cancel programs just to be here. And I'm very sure you enjoyed your time. Your time wasn't wasted. And please, let's take this journey further more. Let's not stop here. Tell those that were not here. Tell those that you know. It's recorded. We are going to post it. Make sure you inform those that need to be informed. Make sure you transfer this knowledge. Don't let the knowledge die here, please. Transfer the knowledge. If you are asked, make sure you tell people, this is what I learned. This is what I've learned. And if you want to be part of this journey, come and join us, because it is a movement. It is not just a webinar that will stop. It is going, we want it to be a movement, because another thing I observed, I know we have other ways here, but there are a lot of menopause now. If you notice, there are a lot of menopause gathering all over the internet, if you notice. But I discovered that Black women, African women, we are very uptight when it comes to things like this. Yes, that's why I had to come up with this, because we are very uptight. If you go to other forum where you have other race, you see them talking, you see them coming up, gathering themselves and talking about it, and you see how they are excited having it. I have a colleague yesterday, he said, oh, you didn't invite me. I'm on one Facebook live that I usually join, and the lady is always talking about this thing. And as we were talking, the next thing I saw was all the sweat just came. He said, did you see that? Did you see that? Honestly, did you see that? He's here, he's here. I said, I said, yes, he's here. And the way she was talking about it, she wasn't scared, but she was trying to make me understand that this is what I go through, but I'm okay. They told me it's normal. He said, but I'm 48, it's so stressful. But these things, because she knows, she wasn't scared, she wasn't anxious, she wasn't freaking out. She talked about it, we laughed over it, and said, oh, next time, oh, I'm not around tomorrow. Next time, please, I want to be part of it. So please, we Black women, I'm going to emphasize on that. Let's wake up. Let's not all of a sudden just see somebody who just say, oh, I'm sick, suddenly, because you were not listening, because you don't want to learn. Let's try and learn. We must learn one or two. No matter the meeting, there's something to take away. Thank you so much for coming. God bless you. Oh, it's a stigma that surrounds our culture. Yes, absolutely. I agree with you. It's a stigma that surrounds our culture, but regardless of that, it's your life, it's your health, it's your body. So you have to tell yourself that I don't care what the stigma is, I just need to get better. I just need to be good. I just need to be well. Oh, thank you so much. I'm so happy. I can't call everybody's name, but I'm so glad that we are all here. We have learned one or two, and I know that whenever we call, we will answer. Dr. Lucy, God bless you. I love you so much. Dr. Tayo, in fact, you've blown me away, because last minute when I was linked to you, the way you embrace it, say, yes, I'm in. I was like, whoa. And the way you say, yes, and I'm in, I'm okay. You never relented. You never stopped. You kept asking. You kept following up. You kept asking me, how is it going? How? And anytime I call, you answer. God bless you. Anytime you call 100, we answer for you. So please, 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 Dr. Tayo, I will keep bugging you. I'll keep dragging you. And I know you will not disappoint. Don't worry, I'm coming to Saskatchewan to see you. God bless you. Thank you very much, everyone. And I hope you enjoy your weekend, the rest of the weekend. Thank you. Bye-bye. Yeah.